Yeah, it's interesting. Also, again, I guess you've got, a government that, is still trying to manage, and at times also a government that becomes very concerned about how people view it, and are they planning well, are they doing the right thing? And so the Mazankowski Commission was formed almost overnight, around the same time the Romanow Commission was working. The Mazankowski group, interestingly enough, they had nurses and doctors on that group. So it was quite a mix of people, very unlike the Alberta Health Services Board that is in existence today, which is almost all business people. Mm-hmm. The Mazankowski committee, the group, the board, or the members that sat in that committee were quite a wide range of people. They were not all business people. But clearly they were a group that were in favor. They were careful to select people that were very much in favor of private insurance. We had people, in fact, that were, some of the board members on the Mazankowski Commission, they actually were on the boards of private insurance companies, so no conflict of interest there. I guess it's not surprising then that the Mazankowski report that came out, the Blue Report that came out, was very much in favor of private insurance, so that people should buy private insurance to get extra care. They also, in the Mazankowski report, they also came out with the idea of having a certain amount of money that you could spend in your lifetime on health care. And so that you would sort of accumulate points throughout your lifetime. If you lived in Alberta, say, for 80 years, and you get, so many points each year, well, then you had these points to spend. And the idea then that, and they picked that up from looking at Singapore and some other countries that, were kind of toying with it. But it's unfortunate, that there were some good points, which is, that we should have more health promotion, that we should help people become well and stay well. There were a few good points in the Mazankowski report, but by and large, this was a very predictable document that came out of a government that was very much in support of private for-profit, sort of as a separate option, but also as something that should be real and live and supported in Alberta. So the Mazankowski Heart Institute now is quite an interesting flag to Albertans that, here is someone who has remained quite prominent. And again, would he be prominent in another province that's not in support of for-profit healthcare? Probably not.